much, Deputy Minister. The Deputy Minister of Information, Director General of Ghana Health Service, Dr. Abwaji, Presidential Advisor on COVID, Dr. Samawaba, officials from the Ministry of Information, Health, and the Ghana Health Service, representatives from partner organizations, and recognized colleagues from the US government and the UK government, the media, ladies and gentlemen. I would like, on behalf of the World Health Organization, to congratulate the Ministry of Health and the Ghana Health Service for the timely response and rapid containment of the Marburg virus disease outbreak here in Ghana. As you all know, the Ministry of Health promptly notified the World Health Organization about the Marburg virus disease outbreak, and I think this is commendable. They did not hide the outbreak, and this is what the World Health Organization indeed recommends to all countries, that do not hide outbreaks, and we are thankful for that action. Ghana has ensured that this particular disease does not spread beyond its borders. I'm also happy to report that since the time the response to the outbreak from the Ministry of Health and Ghana and partners started, it has been swift, consistent, and very focused. It is heartening that within 6 weeks after the detection of Ghana's first Marburg virus disease, this outbreak has been officially declared over. This has been achieved, as we've heard, through a coordinated response across all pillars of the response. That is the surveillance, strengthened laboratory support, contact tracing, infection prevention and control, the case management, and indeed community mobilization. Distinguished ladies and gentlemen, let me take this opportunity to thank all the health workers at the national, regional, and district, and indeed the community levels, who through their efforts significantly contributed to the quick containment of this outbreak. Ghana, as we've heard, has recently been battling other outbreaks, and again, the surveillance system, as we've heard, has demonstrated that it is up to the task. And I think we need to condemn all contributors to this work, our partners, and indeed the health workers that continue to toil on a daily basis, looking out for the different pathogens that may emerge in this beautiful country. It is also important, ladies and gentlemen, that partnership that has been demonstrated through this response continues to flourish. I'm aware that my colleagues will speak, but from WHO working with the UK government, for instance, will continue supporting the strengthening of the integrated disease surveillance and response, the outbreak investigation, and as we've also heard, we are also both going to contribute to the socio-ecological and the animal study that is proposed to take place here in Ghana. I'd like to conclude by stating that WHO is committed to supporting the Ghana Health Service, attain its vision of universal health coverage, and making Ghana a safer country against all potential outbreaks. I thank you.
WHO representatives, all other government officials presented here, and development partners represented here as well. Members of the press, ladies and gentlemen, good morning, or afternoon in this case. It is an honor to be here with you today to celebrate, to represent the United States government, to celebrate this important public health milestone for Ghana and indeed for the world. On behalf of our interagency health team, including the U.S. Centers for Disease Control and Prevention, U.S. Agency for International Development, and the U.S. Naval Medical Research Unit, I would like to congratulate the government of Ghana, the Ministry of Health, and the Ghana Health Service for their exemplary leadership to swiftly contain the Marburg virus disease outbreak, which was declared early July this year. Your quick action, decisive leadership, and technical expertise prevented further spread of this extremely dangerous disease to the larger population, and therefore protecting and saving countless lives. As soon as the outbreak was confirmed, you all got to work. with U.S. government agencies and other bilateral and multilateral partners in support. The Ghana Health Service took the lead in contact tracing, in laboratory testing, supply chain management, and ecological studies to track and contain this outbreak. It was truly a prime example of country-led and country-owned disease outbreak response. The U.S. government and the government of Ghana have been working together for several decades on addressing critical public health issues by supporting disease surveillance, laboratory strengthening, health communication, supply chain management, and other essential components of a robust and effective public health system. And I believe it is because of this long-standing and trusted relationship that we were able to react so quickly to new challenges, starting with COVID-19, now with Marburg virus disease behind us, and of course, monkeypox is our next challenge. We will continue to work hand in hand with our host government and partners such as WHO, UNICEF, FDCO, and others to maintain extreme vigilance in order to prevent, detect, and respond to emerging health threats facing our country. Again, on behalf of the United States government, congratulations to the government of Ghana on achieving this momentous public health milestone on ending the Marburg virus disease outbreak. Thank you very much.
Please subscribe to Morris TVGH.